Bristol Health Partners gives us a fantastic opportunity to basically kind of drive collaboration at a whole lot of different levels in the city. We've got a focused way of doing that through these things called health integration teams. So we take, say, a condition or a public health priority or a challenge like developing safe, healthy, inclusive neighbourhoods, and we try and build a team around that from the academic sector, from practitioners, from the public, from clinicians, anyone who's concerned with that particular topic. But in many ways that's kind of a micro model of integration. And what we're interested in now is how can we do much more ambitious stuff, which is about some of these big broader themes that we're trying to tackle across not just this health economy in this city, but in general. And using data better is one of those. And so events like this, I hope, will allow us to make new connections, meet new people, but start to actually think about doing new work in areas, for example, like experiments on the open data platform or on Bristol is Open, and to try and design that work in a way which isn't just kind of coming out of the health sector in a sort of professional sense, but which actually is shaped in a much more ambitious and real way by people who live in the city. So that's what I'm really sort of hoping we end up doing. So we're going to run another few, at least I think, of these sort of these meetups, and what we want to try and do in all of those is to share good work that's going on in and around Bristol, which hopefully people won't have heard about or will get excited by, but also to try and develop a bit of a community of people who are interested in, but maybe not that well connected to the health system at the moment, use it as an opportunity to develop that, and hopefully keep and develop a community going outside just the sort of the every few months worth of meetings that we managed to sort of put together. So, I want to mention the partners in the partnership. So Bristol Health Partners comprises all of our local NHS organisations, the two main hospital providers and the Avon and Wiltshire Partnership, who provides mental health services. And we also have local commissioning groups who buy hospital care on behalf of populations as our members. We've got both local universities, so connecting to a huge amount of capability from an academic perspective, and uniquely among health partnerships in the UK, we also have Bristol City Council as a full member. So that potentially is a really powerful network of organisations and people if we can just find more ambitious ways to sort of collaborate together. The other people I just want to mention would be the Academic Health Science Network of the West of England and the Local Enterprise Partnership of the West of England, with whom we're kind of jointly supporting a series of these meetup events, and then specifically as well for the sponsorship of this event, Lenovo and Divine Chocolates, who helped us out by actually fronting up with some sponsorship, which has been very much appreciated. So I think there's often quite a strong representation from the academic community. So people are looking for interesting research to do or work which they can find ways to evaluate the effectiveness of, because that's like a big theme of the partnership working as well, is not just to do innovative things, but to evaluate their effectiveness in a more rigorous way than we often do. What I'd really like to kind of see more of is the public, patients, people who are interested in shaping the health system, who've got a particular take on it, because we're very, very good at convening discussions amongst professional groups, less good at making those discussions genuinely open. So if there's a group I'd like to see better represented, it would be the public who are interested in health and tech and how those things are going to connect, not just people who are working within each of those sectors.
So you get the feedback on.
Yeah, exactly. And also they can, in some meaningful sense, kind of shape the agenda that's developing. So, for example, we've seen today with Bristol is Open, that's an enormous opportunity if we can just be imaginative about what we experiment with. And it would be great if some of those experiments were coming from people's ideas rather than, if you like, professionals' ideas.